So you got the dreaded news. There is an outbreak of hand, foot, and mouth at your child's school. Welcome to Should I See a Doctor, your guide for child health. I'm Meg Conover, a physician assistant and mom of 2 young boys. Today, we are covering everything you need to know when you see those dreaded spots on your kid. I will help you determine if it's hand, foot, and mouth and what you can expect during the course of this illness. We will even cover the weirdest and strangest symptom of hand, foot, and mouth that presents sometimes months after the disease has gone away. Let's get started. But first, if you're a mom of a young child looking for more detailed and personalized expert guidance and support, consider joining our community of moms. Comment community below and I will get you in. Hand, foot, and mouth disease is a common viral illness that primarily affects infants and children under the age of 5, but it can also affect adults, specifically the parents of those children. It's caused by a group of viruses called enteroviruses, most commonly the Coxsackie virus. Let's start off with symptoms. The symptoms of hand, foot, and mouth usually begin with a fever, but not always. You're going to see reduced appetite, sore throat, general feeling of being sick, and in these little guys, you might see that they look tired, glassy-eyed, less interested in activities, they tire more easily, and most obviously, they're going to be refusing food, usually because of the lesions in the throat. After the fever starts, these painful sores develop in the mouth. These are seriously painful. They hurt. These sores usually begin as red spots, often in the back of the mouth. They can blister, they can become painful, they can be on the cheeks and on the tongue as well. They're so painful that swallowing hurts and your child will likely be fussy, not want to eat hardly anything, and maybe not want to nurse. One of the earliest signs I look for in my kids when there's an outbreak in their school and they have some of these symptoms are the red spots in the back of the throat that you see here. These are usually a pretty good sign that hand, foot, and mouth has entered our household. A skin rash can also develop over 1 to 2 days. This rash is usually flat or raised red spots, and it appears usually on the palms of the hands and on the soles of the feet and oftentimes on the buttocks. It can also appear on the knees, on the elbows, and in other genital areas. The rash doesn't really itch and it's not that painful. It usually starts as flat pink or red dots and they progress to raised lesions and fluid-filled blisters. Once the blisters are scabbed over, the child is considered minimally contagious and can usually return to daycare or school. Remember, those fluid-filled lesions called vesicles contain highly contagious fluid. You don't want to touch it. It's important to note that after you get the virus, the incubation period or the time until you see symptoms can be about 1 to 10 days with an average onset of 3 to 5 days for symptoms. Keep these numbers in mind if you're a parent of a child with hand, foot, and mouth and you're wondering if you've caught the virus or if one of your other kids has caught it. One of the weirdest findings in hand, foot, and mouth is the nail changes that usually arise 3 to 8 weeks after the virus. It's a big word called onychomatosis, which means shedding of the nails. You may also see peeling of the skin of the fingertips. It's essentially painless, but it can look pretty gnarly. My 4-year-old has gotten this at least 3 times in his life, and every single time, all of his toenails and fingernails shed and fall off. But it's not to worry, they eventually grow back to normal. It just takes a while. Here's how it spreads and how you may be able to prevent spread. It's highly contagious, and the virus can be spread through close personal contact, respiratory droplets, contact with contaminated objects like toys, utensils, surfaces, pillows, and even through fecal matter or poop. It's most contagious during the first week of the illness and sometimes before children even have symptoms, but the virus can remain in the body for weeks after symptoms have disappeared, even up to 10 weeks in the stool. Be careful changing diapers and wash your hands often. Exclusion of infants and children from childcare does not prevent the spread of hand, foot, and mouth disease. The viruses that cause hand, foot, and mouth disease can be spread by children without symptoms, before they get symptoms, and in children whose symptoms have resolved. Exclusion from childcare and keeping your kiddo home is appropriate and reasonable if they have fevers, they're not feeling up to participating, they haven't been eating as much, or they're tired. This might be necessary also if they have open blisters to prevent spread or secondary skin infection, or they have extensive drooling from mouth lesions. All of these things could require their daycare teachers or school teachers to need to provide them more care, which would take away care from other children. Keep your kids home until they're feeling better. Typically, children stay home from school about 4 days when they have this disease. This gets super tough when multiple siblings in one household get hand, foot, and mouth, and they're spaced a few days apart. Last year, my boys had this. They missed a total combined of 10 school days. Each of them missed a full week of school. This can be tough on parents, but knowing what to expect might help. Good hygiene practices such as frequent hand washing can help reduce the spread of hand, foot, and mouth. It's important to clean and disinfect frequently. However, it may be impossible to prevent the spread in your household. Don't be too hard on yourself and expect other children in the house to get the disease, and maybe even the parent. My husband got it last year. I didn't. Wash your hands frequently with antibacterial soap. There's no specific treatment for hand, foot, and mouth disease. It usually resolves on its own within 7 to 10 days, but likely your child will start to feel a whole lot better in about 3 to 5 days. In the meantime, you can help relieve symptoms by ensuring that your child stays hydrated, using over-the-counter pain relievers like Tylenol or Motrin to reduce fever and pain, which is usually associated with the mouth lesion. When we reduce the pain of the mouth lesions, the children have an easier time staying hydrated, and they'll take in fluids and they won't get as sick. Also, you can try a couple drops of Mylanta, the stuff in the green bottle, store it in the fridge, and you can get cooling relief of these mouth sores. You can use it on a cotton ball or a little medicine dropper to drop a couple drops in your child's mouth. Sometimes it'll work, sometimes not so much, but it's something you can try. Encourage your child to drink fluids. Avoid acidic or spicy foods like fruits that are acidic or salsa that can make mouth sores more painful. Even tomatoes and spaghetti sauce will hurt. Lidocaine or mouth numbing treatment is not recommended. There's a lack of evidence that it works, and it can cause possible harms such as toxicity. Benadryl, also not recommended for the same reasons. There's toxicity associated, and it's not going to give a whole lot of relief. Also, keep in mind, hand, foot, and mouth is usually seasonal, and yes, your children can get it every year. We often see it in the spring and summer. Hopefully, it's more mild with repeated cases in your kids. When should you see the doctor? Most cases of hand, foot, and mouth are mild. They don't require medical treatment. However, you should see a doctor if your child's symptoms worsen, if they are unable to stay hydrated, they don't have enough fluid coming in, or they have less than 2 wet diapers in 8 to 10 hours. Also, if they have a weakened immune system, get them in for a check with a pediatrician. Additionally, if your child has a high fever that doesn't respond to medication or symptoms that don't improve after 10 days, it's time to talk to your pediatrician. There can be complications from hand, foot, and mouth, but these are exceedingly rare. Thank you for joining me today to learn about hand, foot, and mouth disease. I hope this information helps you feel more prepared to manage this common illness. If you think I missed anything or have any experiences of your own that you want to share, please leave comments below. I try to answer all of them. And if you still want more personalized advice in real time, don't forget, join my mom community, comment community below. Until next time, I'm Meg Conover. Stay healthy and be prepared when sickness strikes.